On this episode of Raising Babies, re bua le batswadi ka bana ba nang le disabilities. Lebitso la ka ke Carol Ofori. We also ask if people understand what some of these conditions are and what they mean for bana le malapa a bone. Re utla ka lona batswadi gore ana la itse go interact le bana and deal with children living with some of these conditions. You don't want to miss this. Le dumedisa kaofela mo studiong sa rona le wena our viewers go gae. Gompieno we get rather serious as we deal with a variation of topics that are somewhat heavy and even sad, but very relevant and dia tlhokega. Now, finding out that you're expecting could easily be the best news in the world. Imba, what happens when you find out gore lesea la gago might be born ka disability? Do you terminate the pregnancy, kapo carry to term, keeping faith and hope alive? Joining us to discuss these concerns is Mzamo Mbuli, clinical psychologist, and Dr. Felicia Molokwani, a fetal specialist, and my lovely studio audience. So I think I'll start with you, doctor. How does a mother or a father, when they go for their checkup, find out whether their child will be born with a disability? Are there tests?
For all the pregnant mothers, we offer a fetal scan, which is done around 18 to 22 weeks. So the scan is basically to detect structural abnormalities. And if we also see patient quite early, we can also offer screening for chromosomal abnormalities. And the common chromosomal abnormality is Down syndrome, because Down syndrome babies are babies with cognitive impairment, or even intellectual disabilities. So it's a screening test that we do. So with those screening tests, it basically will say if the patient is at high risk of having a baby with a Down syndrome or some certain congenital abnormalities. So we need those mothers to come early because the first trimester screening for chromosomal abnormalities, we offer it around 11 weeks to 13 weeks, 6 days. That's basically for chromosomal abnormalities.
Okay. And can we get this free at our hospitals, or is it something that one has to pay for?
The services in terms of antenatal care in public hospitals are free, but in terms of fetal medicine specialists, we've got limited services in public, So not all the hospitals offer that. If I just give an example, in Gauteng, we've got the services at Bara and then at Charlotte Macheke, and then in Pretoria it's at Steve Biko and Kalafong Hospital.
Okay, so it's important for mothers to find out in their region where they can find these places.
Yes.
Now I have to bring you in, Mzamo. You're a mom, you've just gone to see the doctor, you find out gore ngwana is going to be born with Down syndrome, for example. What is your advice when a mother comes to see you for a case like this?
Sure, I would say the most important thing for the mother is not to internalize it or personalize it. For example, say the child has been diagnosed with Down syndrome. It's got nothing to do with you. It's a child, because most parents tend to internalize it. They see it as a failure on themselves. Hence, they would want to terminate. And then secondly, whatever you decide as a parent, if you're married, obviously you consider your spouse. It has implications. Whatever you decide.
Whatever you decide.
Speaking on your partner, your in-laws, and most importantly, on yourself.
Do you see often cases like this? People come to you with such concerns?
They would come later.
Is it? When you say later, when the baby's born and the baby's older, or when?
Say, for example, they terminated the pregnancy, and we see them 4, 5, 6 years later. Now they're presenting with major depression, anxiety, but when you get to the root of the problem, it's guilt and shame for having terminated pregnancy 5, 6 years ago. So it manifests later in life.
Doctor, let's talk about the options now. Termination is an option, and legally it is an option. Can you walk us through that?
If you look at the Choice of Termination Act, it says every woman can request termination of pregnancy, before 12 weeks, you know. So this is just a patient requesting that on the physicians.
Now, you say before 12 weeks, however, you can only pick up Down syndrome at 18 weeks.
So you can still pick up Down syndrome. Okay, let me maybe go through the steps for Down syndrome, you know. So, So the first step is a screening. A screening, when you do that, it hasn't diagnosed that the baby is definitely a Down syndrome. It will tell you that the baby is at high risk of being a Down syndrome, so which is the test that we do by a sonar around 11 to 13 weeks, 6 days, where we measure the neck of the baby and we're checking also for the nasal bone. If the neck is quite thick and there is no nasal bone, it puts the baby at risk of being a Down syndrome. But I haven't said that the baby is a Down syndrome. So you have to do a further test, a procedure to confirm that the baby is a Down syndrome. So if the patient comes later, you can also do another test called amniocentesis. Amniocentesis, you're basically putting a needle, you go through the uterus, you know, so to draw.
Sounds dangerous.
It is associated with a small risk of miscarriage, but we counsel the patient, you know. So, but those are the tests that you can do to confirm, because the screening has not confirmed.
Yes. Let me ask you now, when a mother has decided to terminate, what would the process there be?
So if you've confirmed the Down syndrome and the patient have decided to terminate, we can offer termination up to 24 weeks, you know, so for those with the Down syndrome, you know, so that's what you go according to the law. But
do you send them for counseling?
The patient, most of the time, we call a genetic doctor who help us, you know, so that they can understand that. Those who are taking the news badly, we ask the social worker and the psychologist around the hospital to see the patients. And even after the procedure, you know, that is being done, you know, they still need grief counseling. Yes, we do offer that. So,
Mzamo, as the doctor's talking that they do offer terminations, do you want to jump in on the psychological effects?
So with the termination, usually cultural beliefs come into play, but as the doctor's alluded, it's up to
and religious beliefs as well,
religious beliefs and so forth. But like I said, it's the effects of the decision, whether to terminate or not to terminate, because it does change your relationship dynamic with partners, family members, friends, and so forth.
And should parents feel bad about making the decision to terminate?
Like I said in the beginning, whatever you decide, it's not about you. Your child being diagnosed, a certain diagnosis, got nothing to do with you as a parent.
Doctor?
So I think sometimes a patient thinks they've done something wrong, you know, so for us, we counsel the patient, try to explain and give them as much information that they should know that they didn't do anything wrong, you know. So at the end, the mother must decide. Us as healthcare professional, we have to support the decision that the patient will make. Whether you continue the pregnancy or you terminate the pregnancy, we support the patient.
What is your advice for parents who expectant mothers who find out their children might be born with some sort of a disability?
It's quite a difficult questions, you know, so because I've never been in such a situation, and I don't even know if I'm in that situation, what will be my final decision in terms of continue or terminating, you know. So I think for us is to explain, you know, so that when you make the decision, you know, you mustn't feel bad at the end of the day.
Mzamo, we could
your baby is a part of you. It's not you. Your pregnancy is not a reflection of you, it's a part of you. So whatever you decide, it's not you as a parent, as a mother.
I love that. I love that. I think I'm going to take a number. I'm going to sit in your chair and be like, doctor, I've got problems. Okay, thank you so much. Very insightful conversation. And at the end of the day, it's your child. So you decide. So, studio audience, I have to ask you, if your child had disability, would you raise your child or not?
I would raise her with love.
With love.
Because it's a gift from God.
Absolutely. Any other of you with a view on this disability?
Hello, how are you?
I'm fine, thanks, and you?
Good, thanks. You're speaking to Kifilwe. Okay. Yes, I would raise a child with disability. I would treat that child as any other child because it's a child that I've been given by God.
All right. All right. Well, we went out into the streets to find out what you have to say about this.
If my baby was born blind, I would raise him just as I raise my other kids.
If my child was blind, I'm not sure because I haven't experienced that, but then I think I'd love him the same and then try to understand the world of the blind and everything. So, yeah, so we'll learn.
If my son was born blind, actually, I would have just take care of him. I mean, teaching him about some other things, that he must be confident of himself.
Okay, if my son was born blind, I definitely would go for counseling. I think I would not be able to take it at that time, but I would keep the baby.
It's my baby at the end of the day. I would give him the love that he deserves. There's nothing, you know, it's still your child.
If I had mtwana special needs, in a special school, la azoba accommodated in terms of his situation, physical situation actually. Right.
If my child was born with a disability, I was going to be happy because it was going to be God-given thing. I won't change because I'm not the creator, only the God knows.
If I had to raise umntwana one disability, like angeke ngibe na problem. Angithi uNkulunkulu yena ongiphe yena, so ngamkhulisa njengoba enjalo ngimthanda.
Ayikho into ebengizayenza, bengizamamukela ngomoya omhlophe ngoba isipho sikaNkulunkulu.
Yeah, to take care of a child who has a disability, maybe he can walk, he can see, is not easy, but is my child. So I have to give him the love and all the support he needs.
Some interesting viewpoints there. But joining us in studio to discuss this further is Mzamo Mbuli, a clinical psychologist. So Mzamo, how does a mother prepare psychologically for the fact that she's going to be raising a child with disability?
Sure. So having a child in itself is very difficult. So you can just imagine when your child has a special need. I'll say three things: support, support, and support. So use your healthcare professionals, your doctor, physicians, psychologists, and so forth. Expand your family support. Get your grandparents, uncles, neighbors, because you will need it.
Now, as Africans, people have different cultural beliefs when it comes to disability. What would you say your insights with dealing with this is?
Look, I think in the past, from a cultural point of view, children with disabilities, it was a shunned thing. It's something parents would be ashamed about. So instead of exposing the child to the world, people would close the child in and not expose them to other children and so forth. But we live in a modern world, and I think that's the way to go. Instead of protecting the child, treat the child as a normal child, any other child. Yes, they have special needs, but they don't necessarily need special treatment.
Now, I have a cousin who is suffering mental disability.
Okay.
And one thing that I picked up as a child growing up is that a lot of the time children would tease him and mimic him and do things that, to me, would have made me feel very, very sad and depressed. Do you feel that children suffering with those kind of disabilities also feel the same impact as children who are not suffering with mental disabilities when others are mocking and teasing them?
It's the same in the sense that when, let's say, for example, when a child is from 0 to 6, they're in a protected environment. There's usually teachers around and so forth. But when you go to primary school, you're exposed to other children. And other children are going to, because the child is different, that's how children are. They are going to pick on that child. So that's why I said earlier on, it's good to expose your child to the world at an early stage for them to get used to the environment.
All right. Any other nice tips you'd like to give us as we wrap up?
As a parent, I'm just going to reiterate, take care of yourself. Yes, you have a child with special needs, but take care of yourself first. Then you'll be able to effectively take care of your child as well. Don't feel guilty for taking care of yourself when you have a special needs child.
Absolutely. Thank you so much, Doctor. You've clearly painted a picture that it's important to look after yourself. Thank you so much for your time.
Well, thank you for having me.
It's clear that at the end of the day, you decide. We'll be right back. Next on Raising Babies 101, we continue putting your child's health first, and we also meet a 5-year-old with a heart condition. le amogela gape mo Raising Babies 101. A lot of children in SA live with serious ailments and some conditions which can be fatal. But no matter the mental or physical challenge, there is a way, especially with today's medical and technological advancements. Knowledge is always the key to problem solving. We are joined by 5-year-old Jaden Steven Trollip, whose tiny heart only has 3 heart chambers instead of 4. He has had to undergo numerous heart surgeries in order for it to keep up with his hyperactive nature caused by ADHD. Here to talk to us is Jaden and his mom, Caitlin. Hi, Jaden. It's a bit shy. Hi, Caitlin. How are you?
Nervous.
Yes. No, that's fine. That's fine.
I'm good.
So you've got a really cute little boy and he seems to be enjoying himself with the cars. Tell us what the journey's been like and that moment you found out that he had a heart condition and what processes you had to follow from there.
When I was pregnant, the gynae didn't pick up any problems. When he was born, he was a healthy pink baby. When he was about 5 weeks old, I noticed he wasn't gaining weight. He was sweating very badly. He was going blue. He would stop breathing. The monitor would keep going off and I couldn't understand why. So rushed him to a pediatrician. The pediatrician phoned a cardiologist by the name of Dr. Sinyangwe, where they did a scan and they said, your child needs to go to hospital now. He needs heart surgery.
His first operation was at 5 weeks?
Yes, he had a pulmonary band. Because basically his pulmonary, he doesn't have a tricuspid valve, so his blood was entering the heart, but it couldn't escape the heart, so it would go in and then pump back into his lungs.
So what does this mean for your day-to-day as a mom?
I'm gonna cry.
Oh, please do take a tissue there. I know it's tough. It's very tough, and as you know, dealing with children who have complications, for parents it is tough, and I think you are just, expressing what you've been going through for the past couple of years.
We had his first surgery when he was 5 weeks old, and then he had his second one at 6 months old. We had a Glen shunt done by Dr. Martins at Sunninghill, and then he got septicemia. And the septicemia was quite bad. The doctor told me he's got a 50% chance of survival, that I must expect worse, that he won't see his first birthday. But now he's almost 6.
Almost 6.
And then in April this year, on the 5th or the 6th of April 2017, he had his 3rd open heart surgery.
Wow.
And then I took him to an educational psychologist because he was showing a lot of emotional problems, nightmares from the hospital.
Oh, shame, yeah.
And then she suggested that we take him to a pediatrician. She thinks he has ADHD. And the pediatrician and the cardiologist both agreed.
That he does. And how does it affect him on a day-to-day basis?
Now he's been put onto Ritalin, which helps a lot. I was always against Ritalin being a teacher, but it really has helped.
So tell me about ADHD. How do you explain that to someone who has no idea of what it is?
It's basically, you know what, an ADHD child is very misunderstood. Very hyperactive, but they're actually very intelligent children. He talks non-stop. He got so hyperactive at one stage he'd climb the security gate right to the top.
Oh, wow.
and a lot of anger outbursts. And
I see.
That they think it is related to the heart problem. It's because of the heart's the operations and all the hospital stays. And from the time he was born, he was in hospital once, twice a month. He was always sick.
And now, are you expecting to be having any more surgeries in the future, or...?
He's had his final surgery done by Dr. Mamorari, who is the most amazing man on the planet.
Yes.
He saved Jaden from the septicemia and he did his 3rd surgery.
Oh, beautiful.
He's got 1 VSD, which is a ventricular septal, I can't even say defect, a hole in the heart, basically. And they're going to close that next year, but they'll do that in the catheter lab. They won't actually cut his chest open.
Oh, great. Okay, well, that's good news in that sense. How's it been for you, though, as a parent? This must be quite tough. I mean, you broke down earlier, just reliving the first 5 weeks of Jaden's life. What's it been like?
It's been very hard.
And what support structure do you have?
Luckily, I've got a great support structure. I've got great friends. My husband is an awesome father.
Oh, that's great.
He's got my husband's mom, and then I've got my mom and dad who've been like my rock. And we've got a lot of close family and friends that have supported us. We've had friends who've done fundraisers for us.
Oh, beautiful.
So we've got a good support structure, but it's hard.
Yeah, it must be hard. We're going to get a question from our studio audience now. Let's have your question.
Actually, what I'm about to say is not a question. I just wanted to tell you that I really admire the kind of mom that you are. I mean, having to go through everything that you went through. I really admire you.
Thank you.
Just wanted to say that.
How does that make you feel? Because clearly you are an example to so many watching at home.
It's awesome to hear that, but, you know, a lot of people say they admire me, I'm a good mom. But, you know, I think any mom, if it happens to them, you don't have a choice. At first, I didn't accept it. It took a few months to accept. But you have no choice. You have to do it, and that's the baby that God gave me. So that's a baby I'm going to raise. And he's got a 2-year-old sister with a healthy heart.
Wow. Well, thank you so much, Caitlin. Hey, Jaden. Are you having fun? Hey? Can I get a hug? I know those, you're very caring to give a hug to me. Yay! Thank you so much, Jaden. Thank you for coming on the show, okay?
So it's a pleasure.
Shame, he's very, very shy.
He's not usually shy. I don't know, now he's...
It's all the lights of TV. Thank you so much, Caitlin, for coming in and sharing your story with us. We really do appreciate it.
It's a great, great pleasure. I hope I can help other moms out there.
Absolutely. Well, we'll be right back after this. Hariboa, we speak about hearing-impaired children. Sisilatelang in Baby's Health A to Z, we unpack the letter D for Down syndrome. Today we're talking about raising children with disabilities, and we're joined by Audrey Katadzira, a clinical psychologist who will speak specifically about hearing-impaired children. So welcome, Audrey. I have to ask you, what are the telltale signs who might be suffering from a hearing impairment?
I think the first thing that we'd want to look at is, are they behaving developmentally appropriate? When you ask them specific questions, are they able to engage? Are they able to answer back? But a more important aspect would be that some hearing loss is acquired and some of it is congenital. So within the first 6 months of life, you could actually detect the potential problems a child could have.
Okay. What is the difference between impairment and disability?
I think the difference is that with impairment, we could be talking within the realm of hearing loss, where it could be partial, whereas with disability, maybe it's now, you know, at a state where it's chronic. That's where we go towards deafness. That's why assessments become necessary, so that you understand exactly what it is that you're dealing with.
Can you explain to us the difference between raising a child that is hearing impaired and a child that can hear properly?
Well, I think the essential aspect to be aware of is that your child is different. That doesn't mean your child is inferior. So as a parent, even though it's demanding to raise a child who's fully functioning, the reality is you have more demands, because you also have to engage with the school context in which the child is a part of, for example, you know, just as an example, and you need to be able to make sure that that environment as well accommodates your child. So I think it's difficult just in terms of the extra level of demand.
That's it. And I was going to ask, with regards to social development for the child, it must be pretty difficult because other children might not be hearing impaired but expect a lot from your hearing impaired child. What do you do in a social setting for your child?
Well, I think before we even go into the social setting, the child has to be given skills to actually be able to know that they are different from other children. And so once again, this could be done within a therapeutic space, you know, where the child is actually, you know, through psychoeducation is taught that you are different, but this doesn't mean that you're inferior. And then in that case, they're able to communicate to their friends, to their peers, to their teachers, or whoever they engage with in order to express their needs, and to not feel shameful about it, because I think that's another issue that happens when children have a disability or an impairment.
Yes. Now, speaking about playing with other children, how do you protect your child from bullying because they are hearing impaired? You know, children, as soon as you're different, tend to pick on you. How do you protect your child from such things?
I think it goes back to giving the child skills, because you'll find with such aspects as bullying, a child who is fully functioning is not immune to bullying. So bullying will happen whether the child is hearing impaired or not.
True.
So it's about assertiveness skills and, you know, just skills to do with being able to express needs. A lot of children are not given those skills at home or in the school environment. How do you express your needs? And how do you also set boundaries with your playmates? And when you find that you're being bullied, how do you remove yourself from that situation? So a child can actually be, through age-appropriate play in a therapeutic environment, be given these skills.
Let's talk about treatment for hearing impaired children. I know it's about getting hearing aids for some children and sometimes an operation and so on. What are the treatments and the options for parents to explore should a child have a hearing impediment?
The treatment really depends on the extent of the hearing impairment and on the type. The main aspect would be when a child is born, particularly within the first 5 years of life, you know, it would be a question of deciding which route are we going to take in order for our child to acquire language, because that's the main thing. So the treatment should have the focus of wanting the child to be able to communicate. So a full assessment, an audiologist or speech and sound therapist, that would be really important, because there's a great relationship between how a child hears and how they communicate.
Yes, absolutely, that's important. Audience members, would you like to weigh in on this? Anyone have a question for or a comment?
Oh, hi, Carol.
Hi.
My question is based on the parents, actually. Is there maybe some kind of counseling that they may go through during that period of their children being impaired or something like that, so that they can be helped and stuff and be more informed on that?
Absolutely. That's a very good question, because I think that's where a lot of parents battle, that they may want to get help, but they feel that they don't have the resources. So the first point of call would be, you know, naturally the medical doctor or the person who's made the diagnosis. This person has discovered that your child has a problem. The moment that happens, it's important to then inquire what next. And the public system does have facilities. You can get that in academic hospitals. The divisions are there, audiology departments, you know. So I think it's really about speaking out and also just acknowledging the context that you're in. Because I do know that there could be a battle in terms of the resources, but the main thing is to, the moment there is a diagnosis, to just say, okay, this is my need. I have a need for support. Where do I go from here? You'll definitely be able to be referred.
Well, thank you so much, Audrey. I think you've unpacked it really nicely for us to find out more about how to deal with hearing impaired children and exactly the steps in dealing with it, and giving the children and yourself the support is very important. Thank you so much, Audrey.
You're welcome.
Coming up next, it's time for our baby shower giveaway. Okay, viewers, as we all know, parenting can be very, very costly. To make life a little easier for you, our baby shower segment is to shower you with gifts. This week, we have a baby hamper to give away. All you need to do is answer yes or no to one simple question correctly. With proper healthcare, can Down syndrome children live past their teens? To enter this competition, answer yes or no on our social media platforms. Answer correctly, and one lucky viewer will randomly be selected to win a baby hamper voucher valued at 1,000 Rand. The winner will be announced on our social media. Best of luck. Unless you're a pediatrician or some sort of medical expert in the field, few can claim to know of all medical conditions in children, and even then, they are being discovered every day. Some of these conditions are heart-wrenching, and as a mom myself, one can only imagine. Our letter for babies A to Z today is D for Down syndrome. Down syndrome is a genetic disorder causing developmental and intellectual delays. It also causes a distinct facial appearance, and it may be associated with thyroid or heart disease. Dr. Baliseng Malifahlo is here to help us unpack Down syndrome. Welcome, doctor.
Hi, thank you for having me.
I must say, you are probably the youngest doctor I've ever seen in my life. That's amazing.
I've heard that a couple of times before, and I'll take it as a compliment, as always.
Good genes.
But I do assure you that I am the right age to be a doctor. And All is well. Thank you.
I have to ask you now about Down syndrome. We've explained it briefly, but if you can give us in layman's terms, what is Down syndrome?
Yeah, so I think you've given a great overview of what Down syndrome is. It's a congenital genetic disorder, congenital meaning that it occurs earlier in conception, and it's there during delivery as well, during birth, so it starts from birth. It's, as I said, it's a genetic disorder, so instead of having 46 chromosomes, which should be 13 pairs of 2, you have 47 with an extra arm on the chromosome 21. It's called a syndrome because it's a constellation of illnesses or constellation of conditions or features or signs and symptoms. The most common, as you've mentioned, are facial features where the person with Down syndrome would be born with a flat nasal bridge. They could have low set eyes. They usually have a big protruding tongue and a small chin. They may also have a flat, the back of the head can be quite flat with much more skin tissue at the back of the neck. Other associated physical features include what they may have a single crease on the palm of their hands or an increased space between the first or the big toe and the second toe.
Oh, I see.
It's, as I said, it's called a syndrome because it's a constellation of other conditions. So it is associated with other conditions, including thyroid problems, most commonly hypothyroidism or low thyroid, where your thyroid is not functioning optimally.
So, Dr. Khonali, myth as well around Down syndrome.
Okay, so there are a couple of myths that are out there. One of them is that people with Down syndrome usually die shortly after birth and they don't get to live that long. With the advancement of medical technology, these kids can be, or these babies can be screened even before birth. Shortly after birth, they can be recognized as having some of these congenital heart lesions, as I said, and things like that can be corrected from much earlier on, and that can very greatly prolong the life of such an individual with Down syndrome.
So how does a parent prepare for wana hai ha tseba gore o tla ba le bone disability e ba bitsang Down syndrome?
So it can be a very debilitating disease, from banally intellectual disability, and they might not be able to go to mainstream school, but jana go grasp some of the concepts or some of the things that we generally learn as children. They may have speaking difficulties. So these are the things that parents should anticipate, especially prepare themselves emotionally for raising a child with Down syndrome.
Now, is it genetic? If mutumo family how unale Down syndrome, are you more prone to possibly having wana unale Down syndrome?
Not necessarily so. So, as I said, it is a genetic condition in a sense that there is an extra gene on the chromosome 21. But that doesn't necessarily mean that if there's someone in the family, you are also going to have it. It also doesn't necessarily imply that one of the parents only this defect in their genes as well. It can occur completely by chance as well.
I see. As we wrap up this interview, Doctor, what advice holistically ukafa batsadi ko gae?
Most of the time, the diseases or this condition is recognized immediately after delivery by the attending physician or pediatrician who assesses the child. But if the parent is already home and they start noticing these illnesses, that the child is not feeding too well, the child is sick, it's important to a hospital or to a private doctor or to the GP or pediatrician timelessly so that the child can be evaluated. As I said as well, it can be emotionally draining, so prepare for support. It's important to have people around you who will support you and help you raise a child with Down syndrome.
Our studio audience, anyone with a question for the doctor on Down syndrome?
Hello, doctor. Down syndrome usually upila up until which age?
It's a good question, doctor.
It is indeed a good question. I can't say with certainty how long exactly they live, but as I said, it depends on other associated things. One child with Down syndrome may be born with congenital heart problems, and obviously their life, if that's not treated, might be much shorter. But if you do get the right medical attention, depending on what conditions that are associated with Down syndrome in that particular baby. And if they're treated well, the child might become an individual, an adult, and live up to ages of 40 or even older than that.
Thank you so much, Doctor, for sharing that knowledge on Down syndrome. It's really been enlightening.
Thank you for having me.
Bagaiso, bulang mahlo le dikelelo tsa lena le ithute ka taba e ya Down syndrome. Learn how to identify Down syndrome and know when and how to seek help. Raising Babies 101 has more for you after the break. See you after this. Raising Babies 101 mo SABC 2. As usual, I get very excited at this time of the show because we sit down with either a yummy mummy or a dishy daddy. Today, I've got dishy daddy and musician, and I think this man has moves for days on the stage. I'm talking about Dr. Malinga. Welcome.
Hi, Carol. Thank you. Thank you.
Welcome.
Oh, we are dishy.
Yeah, dishy.
Dishy. Yes.
Now, Dr. Malinga, ke tseba gore o na le bana ba itu.
Yes.
Tell us about bana ba hao ba itu.
Their names are Tisetso. He's 11, by the way, ne? And also Victoria, my last born. She's I don't want to say my last born because of I'm busy generating.
Yes,
generation. So she's 5 years old, and all of them they are born June. So something, and me I'm July, and then my wife she's August. So it's June, July, August.
The whole of winter.
Yes, wintering system.
Yes. Now, Dr. Malinga, in this episode, we spoke about some very serious disabilities that families face with regards to their children. Mo family, how do you have anyone or suffering the disability mo baneng?
Fortunate enough, I don't have. But even when I had one, I will just love them, you know, cherish them because of God gave us these kids so that we can love them no matter what. So, but now I don't have, yes.
Yeah. Okay. Now, I recall a very amazing moment and I think every father wants to be able to do that for family yabone. When you posted a picture of the beautiful home that you had bought for family how did that feel like?
Yo, because of buying that house, you know, because of me, I'm a hard worker, you know, and then I never forget about my family. I started with my mother, building her a house and also build one for my grandmother. And then I just said, okay, I'm done with my family. Let me go to another family. Do you understand? So and I bought a house, whatever. So I'm just happy to have them like around me, you know. It's just a blessing to have a house. It's a home. It's not a house, actually. It's a home. Like, it's where we meet, you know, when they're from school and wherever. When I'm from my performance, we meet and just eat together. Something like that. Fire, rubber shaker, rubber nika, boka. How many? Yes.
I love that. What kind of a parent is Dr. Malinga? Ustrikti kapo, you let bana just sort of have their way and make aling stricti.
Yeah.
What kind of parent?
The Dr. Malinga is like, I will never say I'm strict or maybe I'm just a free father, you know. But at the end of the day, I want my kids to respect one another, to respect their parents, something like that. I'm strict when you are wrong. And then I'm every time we're just having fun, you know. And then what I love about my kids is that they love listening to my music without me forcing them to listen to my music. When they're dancing, it's like the grocery system for the food. So we're just happy. Guess what? We live once. You just have to celebrate with your kids, you know, just to show them that they must be happy because of they will see happiness through their parents, you know. If I'm that guy, that means I'm training them to become angry. Do you understand? So I'm training them to become just like Batubaba happy, you know, just loving, you know, simple as that. Yes.
How important is education for Wena Lebanabahao?
Education is important, you know, because of at the end of the day, whether you want to work, like to own your businesses, but at the end of the day, you need to have education so that you can run your things, so that those employees don't run with your money. running system. So you have to run your business and then get education. Otherwise, but a runner,
do you ever ever have moments where le jiva kaofela and do your signature moves? And can they do it better than you?
You know, I will sound selfish, but you know, Dr. Malinga have the energy of like, can I when she thought, I can't keep up. I can't papa mara or father. So we just, because of I can't compare the energy, you know, kids energy, a fathering system energy, mother mewabona usha, mabona, you know, her name is Butumelo, usha, one monorshem, what let's all rata more relationship in and I guess what, little naranya go ratiwa, remo rate back. Love back. Yes.
Let's talk a little bit about bullying. We live in an era where banabanyane a lot of the time are bullied, and these days bullying can come even from social media. Nice. Now, I know Bana Bahao have a very famous father who's out on television, on stages, and some children might be jealous and decide to pick on your children. Yeah. How do you deal with bullying for Bana Bahao?
Let me talk it like, but in general, because of I never had that experience, because of their father is happy. When their father is happy, they just celebrate with them. You know, I never had that experience. No. So, but to those who are being bullied, say to ma, tell your mother, because if you don't say it, your mother will never know. Do you understand? You have to be able to talk to your mother. Mama bambeta. Asura ba ubeta or style or maybe whatever. You must report them because they are doing a wrong thing to you. No one is allowed to do what they're doing to you. Wangre. Habarika. Give them Jesus, but because of Jesus who feel mulomo, or report go batswaring, mama bambeta, so that your mother will solve it. Level fathering system.
I love that. I love that. But how are they also as extroverted as you?
Guess what? I will be honest. You know, the T-set one, the boy, 11 years old. He's shy like mewahai. One more no shame what's king. Also he's ukabara repeal monat. Can't guess what lifestyle we cater to shy. So the support the mobu shy in bahai. Angra abo papa bobo. Abo papa bobo. Ergas papi bobo. So Victoria. Yay! Guess what? I can that's why we like to trainer or a pilot just I'm gonna get investor so that I give a little private jet so marijuana for visa. For visa, Nana. For visa.
Let's get a question from studio audience here, Rona.
My question is that like kidding so audience like to make sure when about by on from when?
Like I said, because of hakele, if ke baruta le thabo, ka mantswe mang ke baruta go rata. Do you understand? And then ba bona re ntate he's a hard-working father. Ka mantswe mang ke baruta leng, ke tlo baruta leng low phela, like in business, something like that. You understand? Simple as that. Because tlala ya beta ngere. Hanga.
Ngifuna ukwazi ukuthi i-energy lo nayo ama-drugs or into ozalwe nayo.
Okay. Guess what? The energy that I have, let me just peg the camera straight. You know, the happiness is pumping. And then babies are a passion. When I have passion, I want to do something and then do you understand me? Since I was born, Dr. Malinga, I don't drink, I don't smoke. I'm just happy. And guess what? I love what I'm doing. Do you understand? Simple as that. It's no drugs. But the drug, I think it was installed by God. Ufaki drug give me. Lengenza gutinga phone ama drugs wasemhlabeni. Rubber shaker, rubber knickerbocker, and kosiam. We told you.
So, Dr. Malinga, what is your advice for Bontate Kohai with regards to Hudisabana Babon?
Bontate batung arfemba na baruna na kora izorle busy ka dilo tse la lwela tsona le borona so la dibeta di kiki guy but guess what, when you have time spend it with your kids. You run around, fool around, swim around, whatever around, something like around anything. I want to just be happy with your family. Oba if badlala ngwana o dlala bolo le na nyana mola le lo ra mono ngara asite go modise nyana mara uno zama wangre.
Yeah, absolutely.
Pero monoro ago nel bolo. Maros gamo fos da yona.
Thank you. Thank you so much, Dr. Malinga, for coming in and chatting to us.
Thank you so much,
Thank you.
Thank you so much.
Well, that brings us to the end of our show, Kajeno. Remember, we love to hear from you on social media. So, Facebook, Twitter, Instagram, YouTube. Look for Raising Babies 101. And remember, as I always say, for me, Carol Ofori, see you next week. Welcome to Pep Talk, the parent's guide to everything to do with you and raising your babies. Some babies respond to pacifiers while others don't. If yours does, today I'll be giving you a few hacks for using pacifiers. The first trick is to always have more than one pacifier lying around the house, in your bag and in your car. The next tip is finding a place to store them. You can keep them in one of these stylish glass jars in your baby's room to keep them germ-free. Keep pacifiers clean by sterilizing them. If one drops on the floor, rinse it with hot water immediately before giving it back to your baby. Also, remember that discoloration, holes, tears, or weak spots mean it's time for that pacifier to be replaced with a new one. When it comes to pacifiers, don't leave your baby's pacifier loose in your nappy bag. Rather, keep them in one of these little containers to avoid contact with germs. You can also get one of these clips to attach the pacifier to your baby's clothing to make it easily accessible for them. And lastly, sometimes babies will drool a little bit more when sucking on their pacifiers, so always have a bib on your baby to avoid drool accumulating on their clothes. If you want to stand a chance to win some exciting giveaways, get onto our social media pages and enter our weekly competition. It has been great sharing with you, and we hope we've been a helping hand through your parenting journey. From myself, Carol Ofori, and all of us here at Pep Talk, goodbye.